Hi, my name is Tina Ham, and today I'm going to give a speech on neonatal abstinence syndrome. According to Herald, the number of babies born with NAS has almost doubled from the years 2009 to 2012, from 3.4 births per thousand in 2009 to 5.8 births per thousand in 2012. This is equivalent to one baby every 25 minutes. Research suggests that neonatal abstinence syndrome is an expected and treatable condition that follows prenatal exposure to opioids and is preventable with proper education. For the next 5 to 7 minutes, I would like to talk about NAS. First, I will talk about what NAS is and explain the current treatment for neonates born with NAS. Secondly, I will discuss community-based education and support as a more effective way to help prevent NAS. NAS describes neonates that have been exposed to any prescription or illegal drugs while in the womb. The types of drugs are most commonly cocaine, marijuana, opioids, and narcotics. During pregnancy, the baby is exposed to any drugs taken by the mother. The drugs travel through the mother's system and through the placenta to the baby. Once the baby is born and is no longer receiving the drugs, the baby will start to present with signs and symptoms of withdrawal. This usually appears on exam between days 5 to 10 of life. Some symptoms of withdrawal include excessive high-pitched crying, irritability, tremors, feeding problems, sleep disturbances, and weight loss. Hudak and Tan stated, "It is noted that with or without the neurological excitability and gastrointestinal dysfunction, all neonates with NAS are at risk for negative outcomes such as seizures and death." In addition, research suggested that neonates exposed to opioids in the womb are at higher risk to be born prematurely and at a low birth weight. According to Hunt, Tuzami, and Collins, in a study conducted at Royal Prince Alfred Hospital in Sydney, neonates with NAS were found to be significantly more likely to have developmental delays, such as growth, social, neurological, and cognitive delays. Infants born with NAS are also at higher risk for becoming addicted to drugs later in life due to the fact that they were born addicted to drugs. Treatment for NAS depends on the drugs that the baby was exposed to in the womb. These infants are often kept in the neonatal intensive care unit for prolonged periods of time. Oftentimes, the Department of Children and Families, or DCF, are involved in these cases due to the use of illegal drugs. DCF also has to evaluate the safety of the infant being discharged home with the mother and family. This situation often leads to the infant being discharged into foster care as a result of the social situation. These families are often not able to be relied upon for proper administration of the prescribed narcotic medication needed for NAS treatment. Methadone and morphine are the drugs most commonly used to treat NAS. During the hospitalization, the infant will be scored using the Finnegan Neonatal Abstinence Severity Scoring System. According to the article based on the modified Finnegan NAS scoring system, this assessment includes items based on neurological, gastrointestinal, metabolic, and respiratory disturbances. This is a standardized scoring system that helps to keep the scoring consistent when used by different staff members, as well as aids in the adjusting of the doses of the medications being used to treat NAS. The NAS scoring usually takes place every 3 hours before the infant is fed. It should also be noted that careful adjustments are made to the medication doses only after the trends in the neonate scores are assessed closely. Also, decreasing environmental stimuli has been proven to aid in the treatment for NAS. I would like to direct your attention to my visual aid. The first graph here shows how babies with NAS have prolonged hospital stay and also the prolonged cost of hospitalization. On this graph here, it depicts how NAS and maternal opioid use are on the rise, and also every 25 minutes a baby is born suffering from opioid withdrawal. This was all found within the National Institute of Drug Abuse 2015. Now that I have discussed what NAS is and the treatment for NAS, I would like to discuss the education that is necessary to help prevent NAS. Proper health education is one way where one can be taught what someone's habits can lead to. NAS is 100% preventable, and there is hope through awareness and providing education to women and physicians about potential risk associated with NAS. It is very important for anyone planning to become pregnant to discuss all medications, including alcohol and tobacco, with your physician. If you are using drugs, including alcohol and tobacco, ask your health care provider for help with stopping as soon as possible. If you are currently pregnant, talk to your physician about the best way to stop using and keep yourself and your baby safe. As you can see, NAS is an expected and treatable condition that follows prenatal exposure to opioids and is preventable with proper community education. To summarize, first I talked about how NAS is expected for babies who are exposed to opioids in utero and the treatment for NAS. My second main point showed you that NAS is preventable with proper education. As a nurse working in the NICU, one of the hardest things is to watch an innocent infant crying for hours because of the horrible symptoms of withdrawal that they experience as a part of NAS. At times, these infants are very fussy and hard to calm despite meeting all of their physical needs, and are oftentimes inconsolable for hours. I hope that by listening to the speech on NAS, you will be compelled to make the right choices for you and your unborn child. Thank you.